right patient. This is the most important step in administering medication. We must make sure that we have the right patient first before providing any information. In order to fulfill this, you must go to the patient and knock, go to the patient's table and put all of the medicine and prescription. Check the prescription and ask the patient's permission to check the name on the wristband. The name on the wristband and prescription should match. Moreover, you should ask at least two identifiers from the patient to check further. Now, this information could be their name, date of birth, or age. This is also a good opportunity to get to know the patient and build a relationship with them. Always greet with a smile and move gracefully. It is important that the patient will be at ease knowing you know what you are doing. Right medication. All of the creatures on earth deserve the right medication. As for the patients, it is necessary for us to double check the names of the medications. Each medicine should be checked carefully. Brand names must be avoided. Expiration dates must not pass. Check if the medications match the prescription. Furthermore, make sure medications, especially antibiotics, are reviewed regularly. Even if the medication has been reviewed prior to being endorsed to you, make sure everything is aligned and correct. Also, take note of every medication given to your patient on your care plan. Right dose. Right dose is short for right dosage. This is to make sure that you are giving the correct dosage, as it is not a must, but it is also a patient's right. First, check the prescription on what are the medicines needed and make sure the amount of dosage that needs to be administered to the patient are all correct and matches the prescription. You can also confirm the appropriateness of the dose using the BNF or local guidelines. If necessary, calculate the dose and have another nurse calculate the dose as well. Right route. Again, check the order and appropriateness of the route prescribed. Confirm that the patient can take or receive the medication by the ordered route. In this sample video, you can see and witness an ear medication. The caregiver will perform the steps on how to administer ear medication by educating the patient and moving her to the right position before providing the medication. It is very important that we know how the medication should be taken before administering it to the patient. In this scenario, the word route is defined as how and where a patient takes their medication. For example, many medications are taken orally. There should be clear instructions on the individual's chart or on the medicine itself directing you to give it vaginally, rectally, in the eyes or ears, through the skin, via the lungs, or any other route. Right time. If your doctor orders a medication at HS, this means take it at bedtime. Some bedtime medications can make you sleepy. If you see the letters QAM, that means take the medication in the morning. Few reminders. Check how many times a medication should be taken based on the prescription. Moreover, double check if the medicine is to be taken at the time of administration. Make sure that instructions from the doctor are followed and notated in the care plan. Right to patient education. Know the side effects of the medication you and your loved ones are taking. Let them know what they are and have them tell you if they feel an unwanted reaction to the medication. Let your patients know what to expect from the medication, side effects, benefits, and reactions that might happen. Check if the patient understands what the medication is for. Make them aware they can and should contact a healthcare professional if they experience any side effects or reactions. Always check the medication before administration. Provide the medication to the patient that is on the prescription. Put it on your care plan and ensure you have signed for the medication after it has been administered. Ensure that the medication is prescribed correctly with the start and end data if appropriate. You should always keep a journal of the meds you take, what time and how much it was taken. If injections were given, write down the injection site since most injection sites should be rotated. Caregivers should write the medication and the amount of the prescribed medication on their care plan. Any medication documentation needs to be initiated yourself and never let anyone document it for you. Right to refuse. At home or in the hospital, people taking medications have the right to refuse medications. If someone tells you they don't want to take something, simply dispose of the medication and call the doctor to let them know. Nurses must legally document a refusal of medication. Few reminders. Ensure you have the patient's consent to administer medications. Be aware that patients do have a right to refuse medication if they have the capacity to do so. Be reminded that with refusal or permission, this must be properly documented in your care plan. Right assessment. Have a copy of the patient's medical history. Medications like blood pressure medications always warrant a quick blood pressure check before giving a blood pressure medication. Ask the doctor what number is too low to give the medication. Few reminders. Check if your patient actually needs the medication. Also, you must check for any contraindications. Lastly, baseline observations if required. Right evaluation. Make sure you check for drug allergies and interactions between different medications. Doctors and pharmacists don't always catch them, and we need to be a third set of eyes. At home, it is important to keep a drug guide so you can check prescriptions against each other. Tips. Ensure the medication is working the way it should. Second, ensure medications are reviewed regularly and ongoing observations if required. Medication administration. Before you start any administration of medication, always remember to wash your hands, sanitize, and wear a new set of clean gloves. Prior to attending the patient, the tools and medicines should be prepared already. To start any medication administration, inform the patient what is to be done as per his or her physician. Make sure the name on the prescription matches your patient's name. You can ask the patient her name to get a confirmation. Double check the medicines prepared against the prescription. Get their vital signs first and note it on your care plan. Educate the patient of the 10 rights of medication administration, which are right patient, right medication, right dose, right time, right route, right to patient education, right documentation, right to refuse, right evaluation, and right assessment. If the patient is okay with this, start the medication process. Offer a glass of water and let the patient know what she is taking, when it should be taken, how long it should be taken, and the effects of the medicine and what it can do for the patient. Let the patient know to inform you of any symptoms she might feel so you will be aware. Carefully assess and note everything on your care plan. Cold therapy is also known as cryotherapy. Before the therapy starts, the caregiver should hand wash, sanitize, and wear clean gloves. All of the paraphernalia needed should be prepared beforehand. When you approach the patient, everything should be all set. Make sure to take the vital signs before performing the therapy. In this session, you should need a cold pack and clean towel to cover the cold pack. Do not apply it directly to skin. Ask the patient as well if she is comfortable. Check how many times you should do it as per the doctor's instructions. Usually, it is about 2 to 3 times a day for 48 hours. Once the therapy is done, inform the patient to rest and you will get back to her after 15 minutes to get her vital signs to be recorded on your care plan. Heat therapy is any method of applying warmth to the body, either in one particular area or over the entire body. Heat therapy works by increasing the temperature of the afflicted area, improving circulation and blood flow to the area. This can ease stiff or sore muscles. Heat therapy is usually applied 48 to 72 hours of undergoing cold therapy. Just like cold therapy, you need a clean towel to cover the warm compress. Just like cold therapy as well, do not apply directly to skin. Perform hand washing and sanitizing before and after the session. Do not forget to take the patient's vital signs prior and after the therapy and make sure to jot it on your care plan. The hands should be washed before administering ear drops. Check the medication label each time to avoid medication errors. Be sure it is the right medicine, the right dose, the right time, the right person, and the right method. Look at the expiration date on the label. To instill eardrops, have the patient lie on his or her side with the affected ear up. Gently pull the lobe of the ear up and back to open the ear canal. Hold the medicine dropper just above the entrance to the ear canal and squeeze out the correct number of drops, then massage. Release the ear and have the patient remain still for 10 to 15 minutes to allow absorption of the eardrops. Repeat the procedure on the other ear if ordered by the doctor.